This segment is sponsored by the DC Department of Behavioral Health. Today is International Overdose Awareness Day, and as college-age kids head back to the university, it's important that parents talk with their kids about the risks of overdose. I recently met up with a DC mom with 2 college-age kids about how she handles the tough topic. But first, here are some further statistics on teen overdose. According to new research, more than 20 teenagers die in the United States each week from drug overdoses driven by fentanyl, a deadly synthetic opioid. It is increasingly found in counterfeit Adderall, Xanax, Percocet, and other prescription pills that fall into the hands of adolescents. Last year, the U.S. Drug Enforcement Agency seized more than 80 million fentanyl-laced fake pills. As a result of this flood of fake pills, the DEA has launched a national awareness campaign with the message, "One pill can kill." It is designed to alert parents about this deadly threat and to remind parents about the importance of speaking to their kids about drug use. In addition, parents are also being encouraged to have naloxone, an easy-to-use medication that reverses an opioid overdose. We recently spoke to a local parent who has gotten that message and now keeps naloxone in her home.
Thanks for having us.
Why did you decide to get naloxone, put it in your home?
You know, it was a little bit of the timing, having teenagers in house and them having their friends over here. And then also, you know, it was really easy to get. There was no stigma in going to go pick it up. It was super easy, went to the local pharmacy, had it, and opened up the package, shared it with my husband and the family, and it was just really simple to do.
What was his reception like?
A little bit of eye rolling, but I think the easiest thing to do is at least kind of like demystify it and take it away. And we opened up the package together. I showed him it.
So Kelly, you have it readily available for your kids?
Yes, I mean they would almost see it every day. It just sits in our cabinet here with all of our other over-the-counter medicine.
What would you say to other parents and you're like, my kid's not listening, or I can't, that's a tough conversation? How would you encourage them to have that conversation, sit down with their kids?
They are listening. I mean, that's the thing. We know it as parents. We see it when they mimic our behavior or when they regurgitate something we've told them to their friends and you're overhearing them. Handle the eye rolling, the oh mom moment, and just have it, because you know, if you don't and something happens, you just would have that regret, and it's so easy to have it and to have it in your home. So when they're off to college, it's not something that's scary. I think any parent has that instinct of wanting to do what's best for their kids.
And you have this tool right now, that's easy to get and easy to have.
Yes.
It is a conversation that is really needed. So for more information, text Live Long DC to 888-811.